Okay, so we're going to wrap it up here. I want to first thank all of you for participating in this very important and very productive, very challenging conversation. I think we've covered quite a bit of ground today, and I think we clearly see that our work is still cut out for us. We at Cochs have always perceived our work as addressing civil rights to a large extent, and we've approached the issues via health care, but we see them essentially as being about civil rights and social justice. So the issues that we've taken on together here in this very room since 2010, was it November 2010, are issues that most people don't really want to talk about. These are issues that kind of make people uncomfortable because at the core, they speak to the issue of mass incarceration of young guys of color, poor guys of color who suffer from mental illnesses and addiction. And so, even though we approach it from the health standpoint, we think that the Affordable Care Act creates a frame in which this highly disenfranchised population, for the first time, has an opportunity to take a seat at the lunch counter. But I am old enough to remember the sit-ins at Woolworth back in the 60s, in Greensboro, where it took 4 years after the sit-in before folks had the real entitlement to service. So when we translate that into health reform and the ACA, the real question is, now that it's here, how long will it take before it really catches on and we really see the movement? So there are a lot of things that we still don't know about the ACA and how it will play out with the justice system involvement. But there's a lot we do know. And so from here, I guess the big tee-up question would be, so who will serve them? This is one of the big questions. We're going to put that out on the table. Who will serve them? Will it be the community providers? Just who will it be? We're going to let Steve kind of take a stab at a couple of these.
Thanks, Mike.